Hi guys, Aisha Castro here from Arete Chiropractic. Today I want to talk about whiplash injury and how does it happen. So during the whiplash, there's a hypoflexion extension of the neck that creates an unnatural S-shaped curve of the cervical spine, which can injure the ligaments, the tendons, the muscles, the joints, the bones, and the nerves. So all the structures around the head and the neck. So during the injury, the hyperextension of the joints of the cervical spine, it makes those joints go to their end range of motion and sometimes even beyond the end range of motion, which can create trauma in there. So whiplash is more common in females or people with smaller necks because the bones and the muscles, the size and the thickness of those structures actually prevents injury. So we can protect people that have bigger necks, and people with smaller necks, which are usually females, they're more prone to having injury. And also pre-existing conditions of the cervical curve, so a lack of the curve or misalignment in there can be somewhat a predictor for injury during an accident. So the lordotic C-shaped curve of the cervical spine, which is the normal curve, is important when dealing with stresses and traumas in the body because it acts like a shock absorber. However, when someone has a pre-existing misalignment in the spine or a lack of the cervical curve or even a reverse curve, when a whiplash type injury occurs, it can create instability from those forces, which are already, the stability is already there, so it can be more prone to injury when you already have a misalignment or a lack of the curve before the accident. And so there's a research paper that was actually originally done in London at the International Medical Congress in '89, and they talked about effective conservative therapies for whiplash injury. So they followed 5 patients who had ligament damage in the cervical spine after whiplash, and they're all treated with medication, immobilization, massage, and adjustment, what they call infiltration of the C0, C1, and C2, C1, C2 facet, which is aka upper cervical adjustment. And what they found was that the Atlastherapy that they called upper cervical care was the most efficient way to basically recover after whiplash injury. So that tells us how that upper neck and the misalignment there is a big piece of recovery. So getting the body in better alignment so the body can heal and recover to the best of its ability. So if you know anyone that's been in a recent accident or sports injuries or any type of whiplash injury, let them know that upper cervical chiropractic can help them recover faster and to the best of their ability. So if you have any questions, just comment below, and hopefully I'll see you soon. Okay, take care. Bye bye.